one of our new members, Ms. Lauren Underwood.
Well, thank you, Mr. Chairman.
Ask for your questions.
Thank you, Mr. Chairman, and thank you to Secretary Vilsack for joining us today. 2 weeks ago, I had the honor of visiting the Northern Illinois Food Bank in Geneva, Illinois, and I was able to see up close the truly incredible work that their staff and volunteers are doing to keep the communities in my district fed, despite huge challenges and heightened demand due to the pandemic. During my visit, the Northern Illinois Food Bank stressed to me how the Farmers to Families Food Box program has been invaluable for distributing fresh, nutritious, ready-to-load food to our neighbors. Between March of 2020 and February of 2021, nearly a quarter of the over 1 million meals they distributed were supplied through the Food Box program. Mr. Chairman, I'd like to ask unanimous consent to enter into the record a comment from the Northern Illinois Food Bank submitted to USDA supporting the Farmers to Families Food Box program and suggesting improvements.
So ordered.
My understanding, based on news reports from this morning, is that USDA is ending the Farmers to Families Food Box program next month. But I was really pleased to see that USDA announced a new fresh produce box program under the Emergency Food Assistance Program, TEFAP. Now we know that the Farmers to Families Food Box program was not without its flaws, but the food it provided has been a lifeline for families in my community. The Northern Illinois Food Bank has valued the variety of food it provided through the program, including the dairy and meat products. They also appreciated the program's flexibility, which has allowed them to distribute food boxes through many more of their agencies that typically can't distribute the TFAP food. So, Mr. Secretary, do you anticipate the new TFAP produce box program will be able to fill the current need? And are you considering flexibility, ease of distribution, and food variety in the TFAP produce box program or other food box programs?
The answer is that we are obviously trying to take the best of the food box program and institute it into and implement it into our traditional distribution system. So I think you're going to continue to see the variety. You're going to continue to see the wholesomeness and the nutrition food being made available to folks. I think you're just going to see it in a slightly different delivery mechanism that's much more efficient and less costly, which means that we're going to have more resources for more food for more people. Number one. Number two, we continue to have enormous capacity to purchase these other products and to incorporate them in what is being made available to food banks and to food pantries. And so I don't think you're going to see a decline or a reduction in the diversity of what's going to be made available to food banks. I think you're going to continue to see us being engaged in this. In fact, this budget asks for additional resources in the TFAP program to be able to do more of what you want us to do. And I think, we've also heard from a number of other food banks that had serious concerns and issues with the program. So what we're trying to do is trying to take the best of what we've heard and eliminate the things that didn't work particularly well, put it into a system that is well known and well functioning to make sure that we continue to get access to as many people as possible with nutritious options and flexibility.
Well, I'm certainly really pleased to hear that. The produce boxes are a great step, and there's obviously a deep level of need that likely requires greater support. So please do let us know about those additional resources that are needed. Now I'd like to turn to another critical nutrition program. I'm pleased to share that I'm pleased to see that in your written testimony, you called out the importance of WIC in addressing the disparities in maternal and child health outcomes, particularly the racial disparities. And I'm the co-founder and co-chair of the Black Maternal Health Caucus, and so expanding WIC is a big priority for me. My Black Maternal Health Momnibus Act includes provisions that would extend WIC eligibility in the postpartum and breastfeeding periods to ensure that new moms have access to nutrition programs that are proven to save lives and improve maternal and child health outcomes. In the skinny budget, the administration is requesting $1 billion increase for nutrition programs, including WIC. Can you provide some detail on how you anticipate USDA would use that increased funding to expand WIC and improve maternal health, including if there are any statutory changes that you think may be necessary?
Representative, I think the first order of business with reference to WIC is to make sure that 50% of participants who aren't participating do. And that's why we were pleased with the rescue plan that provided additional resources for us to reach out to states to figure out ways in which we can be innovative in creating better understanding of WIC and better participation in WIC. We want to close that 50% gap. That's the first order of business. The additional bonus that's in WIC because of the rescue plan, the additional resources we're asking for will allow us to continue to provide a decent benefit, but it doesn't help if people aren't taking advantage of it. We're looking for partnerships. We're looking for ways in which we can get the word out about WIC and make sure that folks fully participate. And I've reached out to governors. I mentioned I'm calling governors. I'm calling governors all across the country, encouraging them to work with us in their Human Services Department to get the information out about WIC. I was at a food bank recently where they put information in the box that they provide to families about SNAP. Well, why can't they also put something in there about WIC? I think we need to look for creative ways, and certainly would appreciate any idea you have that would expand outreach that would enable us to close that 50% gap. It's very concerning.
Yes, sir. Well, I certainly look forward to working with you on that. I yield back.
Underwood, your time has expired. Hopefully you can get back for an additional round of questions.
Well, thank you, Mr. Chairman. Mr. Secretary, I wanted to follow up on WIC. Are you considering other actions beyond outreach to improve WIC, particularly with a specific focus on improving maternal health and addressing the Black maternal mortality crisis?
We are going to look the resources that have been provided to the rescue plan, I think, create opportunities for us to take a look at ways in which we can expand the impact of WIC. Let me give you an example of one kind of partnership that might be available that we need to be thinking about. There's an organization called Count the Kicks. It's an organization that basically encourages moms to be able to count the kicks periodically, and if the kicks get below a certain number, then it may indicate that there's some problems. And in minority populations, there are higher rates of stillborn babies than in white population. And so this is an opportunity potentially for a collaboration between an organization like that and WIC to basically co-promote each other so that you are counting the kicks and having healthier babies being born, and also providing those moms and those babies and children with more nutritious food at the beginning of life. So I think there are ways in which we can look for those kinds of partnerships with organizations that have a mutual interest, if you will. And I'm certainly interested in your thoughts about how best to do that, ideas that you have from your congressional district that could be incorporated in that effort to try to find creative ways to make WIC more attractive, to make WIC more effective, to make WIC participation at higher rates.
Yes, sir. I appreciate that. I do just want to note that, the stillborn and infant mortality and infant health issues are incredibly important, but so is what's happening to our moms. And the fact that mothers continue to die at 3 to 4 times, Black mothers continue to die at the rate of 3 to 4 times than the white moms in our country in terms of maternal mortality. And I think that the WIC program is a unique tool that we have, particularly to extend WIC coverage in the breastfeeding and postpartum period. And so we will certainly be following up with you on that. We do have legislation to that end, the Social Determinants for Moms Act. And I think that this is certainly part of an equity agenda that the Biden-Harris administration would support. And it's Black Maternal Health Week, so I had to make sure to cover that. Now, I want to shift a little bit and bring your attention to a bipartisan bill that I introduced with Congressman Gallagher this week, the Farmers Fighting Climate Change Act. And this bill would support producers on the front lines of the climate crisis by establishing climate change mitigation bundles within the Conservation Stewardship Program. I believe my bill fits in well with your ambitious climate change agenda at USDA, and I look forward to working with you to advance solutions that are fair to our farmers and have real impact on the climate crisis. Thank you, Mr. Chairman, and thank you, Mr. Secretary, and I yield back.